I guess there's been the obvious question of how on earth do I fit into this bigger picture of making change, and especially when you're surrounded by very important people who have spent their life doing really good research and work in the areas of social determinants of health and associated areas. So that's been a bit of a challenge to, I guess, figure out where I fit in that picture and to not get discouraged by the fact that there's been so much work done in the past and yet we're still not really anywhere near where we should be. Within the group there's been a lot of synergy of ideas and networking and I guess support for each other. That we are kind of like-minded people. We're all at relatively similar stages in our careers, although those careers are really diverse. And that I guess there's a feeling that well, on that really basic level, we're not alone. There's other people aiming for the same things in our generation, and that's a bit of a comfort. Because we've got a mixed group of some people working at the grassroots in service delivery, and we've got others who are researchers and others who are at the more policy level, I think we've got a pretty good breadth of knowledge between us about the way the world works. And certainly there's been an appreciation that it doesn't always mesh together very well, particularly for Indigenous issues and healthcare on the ground. There's a recognition that the research which is done is often not applicable, or even if it is applicable, it doesn't translate very well. And part of that is about selling the research in an appropriate way. And I think that the responsibility of that rests not only with researchers, but in about the way we go about our work in health more broadly. And my personal opinion is that really the way to go about fixing that, especially in Indigenous health, is to do the research with the communities who are the subject of the research and the recipients of the benefits of the research. It's not going to be possible to make research which is relevant and applicable if we don't actually include the people it's about. So I think researchers probably have a bit of development to do around appreciating that it's not so much about us as researchers making research to give to other people or to transfer to other people. It's more about the collaborative process of setting the research agenda in the first place, as well as actually doing the research with the people who matter. Yeah.